A milestone today in San Diego. The COVID-19 emergency has ended. And while the move is largely symbolic, it is a turning point into a new phase of the fight against COVID. My co-anchor Wale Aliu is joining us live from Chula Vista with an in-depth look at how we got to this point. Wale?
Well, go down memory lane with me, Kimberly, if you will. I'm standing near what used to be the location of a COVID vaccine superstation here at the old Sears building in Chula Vista. Thousands would come get their shot during the height of the pandemic. It was one of the 4 superstations that opened in 2021. The county actually declared its COVID emergency before the state on February 14th, 2020. California followed suit on March 4th. Okay, so it's empty now, but here's a look at what this location looked like in early 2021 when the superstation first opened. The South Bay was hit hard, so this location was a welcome sight to those in the area. It had the capacity to offer 5,000 shots a day. It closed in late June of 2021. Now, Supervisor Nathan Fletcher led San Diego's COVID response. The county and state both had tight restrictions, but Fletcher believes those actions saved lives. He told 10 News, "We are in a new phase of this fight, and the county is well prepared."
I think it's appropriate now. COVID, because of the vaccine, because of the boosters, because of the treatment, is now in an endemic status, not a pandemic. People have the means to protect themselves from severe illness, and I think that it's time to end the state of emergency and go on with our lives.
Now we got to tell all sides of the story because there has been some criticism of some of the COVID-related policies. The president of the San Diego Police Officers Association, for example, voiced his opposition to the city's vaccine mandate for city workers. He claims it caused more than 130 officers to leave the agency. In a statement to 10 News, he said in part, "The city of San Diego's vaccine mandate and threats to fire longtime employees over the last 2 years had a crippling effect on police staffing and response times." The city defended the mandate, saying lower recent case rates show vaccines have been effective and the mandate was an appropriate measure. For now, the county says free COVID-19 vaccines and treatments are still available. That is because the federal COVID-19 emergency does not end until May. That's when the cost to treat COVID-19 is going to become more apparent to everyday people. We spoke to Dr. William Sang with Kaiser Permanente, who laid it all out.
What they used to pay for vaccine, which was federal rate of $30, is now going to be like $120 something dollars. And what the Paxlovid medication that was free is going to be about $530. So where is that going to end up? Nobody really knows right now, but it is a cost. It is a burden that is shifting from the Fed side to the insurance and private sector side.
The end of the federal emergency could affect health coverage for millions across the country. The state of California says Medi-Cal recipients will receive a notice if eligibility or coverage changes. All right, Kimberly, that's going to do it for us from Chula Vista. We're going to continue to provide updates, though, of course, related to COVID as we get them. We'll send it back to you in the studio for now. Kimberly.
Yeah, lots of changes, including the costs for patients. And thank you for that info, Wale. We appreciate it.